Hi, everyone. Sorry about that. We got disconnected there. We'll get Dr. Houshmand right back on.
Hello
Hi,
again.
sorry about that. Little hiccup there.
So you know what? It only allows you 1 hour. So because you had been to your hour mark,
Yes,
you're out.
exactly, exactly. It said no more. I said no worries, Instagram. We're just going to start over. So I wanted to ask you a little bit about something that's also been relatively common. We've been in this pandemic now for over 6 months, nationally, globally, and whether you're in healthcare or general public, something that's very common practice for people is really, the wearing of masks. For good public health measures, we're really recommending that people wear masks to really prevent transmission of this virus. As a consequence of, mask wearing, people are having some different skin conditions, and something that's been coined, a new term called maskne, it has become a little bit common. So I was wondering if you could tell us a little bit about that, let our viewers know a little bit more about that and how to essentially take care of that and treat that and what they need to do.
Absolutely, I'm happy to do so. So maskne is real, and I've seen quite a bit of it, and I've had it myself as well. As I shared with you, it's very hot and humid here, and so I'm recommending for patients to definitely wear a mask. I recommend that they wear a double-lined cotton mask. If they can wear one of those surgical not N95s, I think we should still reserve those for our frontline healthcare workers. That's really critical. And then I've been asked a lot about silk masks. So I want to say silk is a better fabric for your skin, but it is not as protective as the double line cotton and the surgical. They've done studies now and are looking at the particle spread. So I would say number one, cotton. Number two, if you can get your hands on a surgical, and then silk if you're just maybe on the weekends if you're around your very close friends or family that you won't have that much contact with. So back to maskne. So what is it? You know that the skin needs to breathe. And so underneath the mask, there's moisture, humidity, and that can create a kind of moist environment. And so bacteria can harbor in there. So my number one thing to take care of maskne is to prevent it, to not let it happen. So what do you do? Number one, you want to use a very gentle hydrating cleanser. I tell patients avoid those heavy, harsh scrubs. Don't use those. Use a very hydrating. So what are some examples? There's tons of great, and another thing, you don't have to break the bank to take really good care of your skin. Because I think a lot of people think, oh, well, if I go to that dermatologist, I'm going to spend, no, you're not. You can really find great products just at the drugstore. So a mild hydrating cleanser, no harsh ingredients. Then, one of the things that I think is counterintuitive is to moisturize this area that's underneath the mask. Why? You want to have a protected and intact skin barrier. Remember, the skin is your largest organ and it's our protection. And so if that barrier, whether it becomes dehydrated or compromised, then the acne will get worse. So the barrier is number one. So a very light moisturizer, like an oil-free moisturizer, is perfect. Again, over the counter, there's Neutrogena, CeraVe, La Roche-Posay. I mean, I could go on and on. Very good quality products, but at the drugstore as well. So that's that. Remember, I'm a dermatologist. I'm going to tell you to wear your sunscreen. It's still critical. The mask does not protect you from getting a sunburn, so you want to make sure that your skin is protected. For my female patients, I tell them this is your perfect time not to have to wear makeup. And I advise them not to wear it. This is a great time to be so low key. You can wear, if you like, a little bit of powder or something, but this much of your face is covered. Wear your light moisturizer, a very light oil-free sunscreen, a little powder if you want, but no makeup. And throughout the day, if you're someone that works, whether outside or you're sweating a lot, I love a good what's called micellar water. A micellar water is a cleanser that does not need water. You need a cotton pad and you can take off all the oil, dirt, debris, bacteria. The main thing is to keep this area well protected and cleansed. And so that's that. And then when you come home and you don't have to wear your mask anymore, my recommendation is that you, again, cleanse with a very mild cleanser and just moisturize. That's it. I'm telling patients right now to avoid use of harsh things like retinols, retinoids, um, glycolic acids. Those are things that I normally love to use. But if your skin is a little bit more on the sensitive side, if you have rosacea, you're acne prone, you want to really be gentle with your skin right now. Over time, if you still have issues, if you're someone with cystic acne or other problems, more significant acne, my recommendation is for sure to see your board certified dermatologist. A lot of us, myself included, are offering telemedicine, and I actually like it a lot. It's been, once you get set up for acne, it's actually a perfect type of thing because I can see you well. We can go over everything. So I don't want patients to feel like we can't help them during this time of COVID. And I want to point out, I've shared with some of my patients, we don't know what's going to happen in the fall. Will
Yep.
they be open? Will they be shut down? So I'm so grateful that we have an option
Yep.
where I can safely see you just like we're talking now. And then, if I find something that I need to do in the clinic with you, well, then we can set a day, but you've already had a chance to see me. You can be in and out for whatever that procedure will be.
Absolutely. That was so, so, so helpful. I really think people watching right now and that are going to be watching later are really going to appreciate that, a wonderful advice you gave them. And it really is something that is affecting not just, as I mentioned, healthcare workers, but the general public. And, it's really important that people take care of their skin and do it so the right way. And those are some great tips that you provided there. And I think the thing that I want to highlight is that if there's any concerns or anything that's lingering despite what they're trying, that people really need to seek out medical care, that physicians, we're all here to help. You're working, you have availability to take care of patients, even if it's virtually. There's no barrier there, that they should really seek out medical care from a board certified dermatologist.
I think the other dermatologist made an outstanding point, and I can't stress this enough. I'd like the viewers to know your melanomas, your psoriasis, your hair loss, your skin cancers are all important, and they're not going away during this time. I don't want anyone to feel intimidated or that they can't get care. This is actually really interesting because with the advent of COVID and offering, like, for example, in the state of Texas, I'm allowed to offer care to the whole state. I can't do anything outside of Texas or international patients or anything like that. But I think that's wonderful. I actually saw a telederm from Houston. She was a former patient of mine that has moved there. So it was so nice to be able to see her and take good care of her even during the pandemic.
That's amazing. That is so wonderful to hear. Well, I can't thank you enough, Dr. Houshmand. Thank you so much for joining me today, and thank you for all the hard work that you're doing. And I look forward to speaking to you again soon.
I can't thank you enough for the invitation, and thank you and all your colleagues in New York. You truly are on the front lines, and we thank you for all your service. I mean, we were the ones sitting back watching you guys, learning from you, and I can't even imagine as a physician what it felt like for you. One of the things that I've shared with my patients, I said, guys, we're all humans. We
Yeah,
as we're scared too, and we're learning with you,
absolutely.
and we all have families, and we want to stay well and healthy, but it is our calling to do this. So I thank you for all that you have done.
We're all in this together, is what I tell everyone, and anyone would do the same that we've done here. So we're here for you guys now, and we're going to continue to get through this together.
Thank you so much. Have a good
Take
evening.
care. Have a good night.